Well, let's kick it off here. Today, our guest is Win Chang, and Win is a semi-retired, and maybe you can modify that for me, orthopedic surgeon who's done a specialty in shoulders. Now, can you take us back, Win, all the way to college and kind of to this day, kind of help people who'll be looking at this, kind of put things in perspective?
Thank you very much for this great introduction, Rob. Yes, you said I'm semi-retired. Correct. I am retired from the practice of clinical orthopedics, but I'm not retired from life. I went to medical school at the University of Rochester back, I don't remember how many years ago now, but I've been a practicing orthopedic surgeon in New York for 30 years. My area of specialty being adult reconstruction and sports medicine, and my area of particular interest being in the shoulder, naturally. And I had my training throughout the years at UCLA, at the Mayo Clinic, and I did my orthopedic training at the NYU Hospital for Joint Diseases. So, and then we met back about 3 years ago when I first launched my invention, my product, Shoulder Sphere, at the 2017 APTA CSM meeting in San Antonio.
San Antonio.
That was way back when, but it's really not too long ago when you think about it.
No, not really. And I'll just follow up so everyone knows I own the company RangeMaster Shoulder Therapy, and we specialize in shoulder pulleys, and we have distribution. We help about 200,000 patients a year through various channels for people that are either recovering from shoulder surgery or trying to avoid it altogether. And so it's been a fun part of our business in this Zoom world to talk to other people who are also related to the shoulder health recovery business. And certainly what a delightful find to run into Win Chang down in San Diego and hear him talk about why he invented the shoulder sphere. And I'm hoping you've got one within reach there, Win, so you can hold it up and everyone can kind of see, and that'll put our conversation in context here.
Okay, sure. Shoulder Sphere is a handheld portable device. It is a patented rotator cuff exercise device specifically for rehabilitation use, injury prevention, strengthening of the rotator cuff, and athletes also take particular interest in terms of return to play, because that is one of the common issues that people face, is that when can I go back to throw a baseball at 60 miles per hour? When can I do my fencing routine again? So we have many common denominators of measurements and ways of assessment, but my motive is based on a fundamental principle that shoulder performance is predicated on rotator cuff performance. Rotator cuff is the hinge for the shoulder joint. It is of critical importance for functionality of the shoulder in terms of movement and particularly stability. With no stability, there's no motion. Well, in terms of how I came upon this device, I stumbled upon it really accidentally. I was practicing in orthopedic in private practice and very busy practice. But one of the most cherishable events that one can remember in one's life is the ability to spend time with your family, play with your kids. And it was about 16 years ago, my younger daughter was 4 years old. At that time, she, like all the other kids, wanted to have a pet as a pet. So I would try to get her a pet and play with her. But of all pets, she wanted a cat. Unfortunately, I have bad allergy to cats, so I couldn't get a cat. But I did not want to disappoint her, so I got her a whole bunch of cat toys. And one day I recall I was playing with her on the floor And there was one particular cat toy. It was like a ball with a bell in it. And I was kind of playing around with her. I was rotating it and spinning it around, just amusing her. And before I knew it, I felt a kind of a workout in my shoulder that I have never experienced before. And then that led me down the rabbit hole and started thinking about, what is it and what is the movement? And as I start to think about the shoulder exercises, really in the world, what we traditionally do and currently do are really based on a linearly directed movement. There's just 4 movements in the shoulder. We push, we pull, we press, or we lift. That's about it. We move the arms. These are linearly directed, one directional. And the purpose of the rotator cuff, as we know with current knowledge, is that there are really 2 functions for the rotator cuff. The 4 muscles of rotator cuff come out from the shoulder blade, the scapula, crop out like a hand that grab onto the top of the arm bone, the humeral head. And one function, as we always do, is directionally based. We do the external rotation movement, internal rotation. We do the forward, the upward elevation, the abduction, and so forth. So that is why all the traditional exercises for so-called rotator cuff exercise, based from back in the 1960s, pulling the rubber bands or lifting dumbbells based upon external rotation, internal rotation, elevation. We external rotate the arm in different positions. We try to hit the particular part of the rotator cuff as to strengthen that.
Individually.
But that is only
individually, right? Like individually.
That's right.
Yeah.
That's right. Exactly. But that is only one facet of rotator cuff training. But the most important part, which is a sort of a kind of a nebulous, is how do we train the real function of the rotator cuff? The real function of the rotator cuff is to synergistically contract all together, all 4 muscles simultaneously to grab onto the humeral head, to secure constant compression, to anchor it against the arm bone, the scapula, in order to make it stable. So just like the hinge on the door, in order for the door to swing back and forth, you gotta have a strong hinge. Otherwise, a wobbly door is caused by a loose hinge. So the hinge is the rotator cuff. But how do we strengthen this compression effect? That is where this rotational principle of shoulder sphere comes in. Because when one rapidly rotate the ball, doing rapid rotation and in a tight manner, it converts the rotational movement into a compressive movement. It takes a little bit, it took me a few years, tell the truth. I'm trying to explain that within a few minutes, but this concept, it took me years to dawn upon. I did my own experiments at home with cutouts, with prototypes, and I'm the only one who can subject myself to needle EMG of the muscle studies. So basically, when you think about if you have to rapidly rotate the ball, to make the ball to move in a 360-degree motion, all aspects of this circle, this circular motion, they must pull and relax on the opposite sides. So the muscle on this part pulls while the muscle on this side relaxes. So that's what we call a concentric and eccentric contraction. So if you can visualize the ball rotating, so one part is pulling, the other part has to equally relax at the same pace. Otherwise, the ball will not be able to make a perfect circle. A perfect circle requires perfect symmetry, concentric and eccentric. So as the ball's rotating faster than 6 times per second, 6 times per second, that is very fast. So as far as the brain is able to interpret at 6 times per second speed is virtually simultaneous. Because if you look at the our video, the pixels, I don't know if you ever try to record something from the TV set where the TV looks like a smooth picture with an ordinary eye. But once when you take your video to try to your recording the TV, the video seems to be scattered, seems to like have pixels on and off, on and off. It's because it's not as smooth as simultaneously occurring as an eye can perceive, but it's very fast, like a 1/1000th of a per second. But the video is able to pick that up. So same thing with the brain. When we make the muscle contract and relax as faster than 6 times per second, as far as we are concerned, is that it is a simultaneous event. A simultaneous event means that it's pulling the human head against the scapula. And that is the phenomenon that you feel. This is an experience and a sensation unlike any other exercise of pulling the rubber band. The closest way of trying to mimic this joint stabilization is what physical therapists do. It requires a separate a pair of experienced trained hands where a person will press against the ball, against the wall, and what they call perturbation. So the physical therapist or the trainer will try to knock the hand out of the position. So by trying to knock out of position, your hand has to stay in position. That is probably the closest way that we can mimic this co-contraction stability of the rotator cuff. But that is not really functional. The shoulder sphere is a functional tool. In other words, it is a freely mobile in 3-dimensional space. So one does not have to think of, I have to do the external rotation to train the external rotators, the internal rotation. I have to get into figure out foot position to target these specific rotator cuff muscles. But once you get the ball rotating in whatever position, all 4 muscles are simultaneously engaged.
Okay,
so
you gotta let me ask you some questions. When
absolutely,
okay,
jump in.
It won't be as fun if I don't get to ask you some questions along the way. Here,
Jump right in.
Okay, so to start with, you basically highlighted something I don't hear very often, and that is the dual function of the rotator cuff. In addition to
Yes.
the linear kind of strength building, you've introduced this whole concept of, I think you used the word compression, but you're really stabilizing. Wow. You're stabilizing the joint, right?
Right.
You're saying.
That's right. One role is of the rotator cuff is to assist directionally range of motion, external rotate, internal rotate. But the major function is co-contraction, where all 4 muscles grab onto the human head, in addition to movement. That's right. That is very difficult. It's a concept that you have to think through. As the baseball pitcher moves the arm from the top to the bottom position, as the arm's moving, the rotator cuff does assist in terms of directional movement. But at the same time, the opposite muscles has to decelerate. So rotator cuff function is a deceleration function. It is a decelerator, not an accelerator.
Okay, so now let's talk about the unstable joint, because as a surgeon, you saw a lot of unstable joints and you saw several different reasons for instability. I first want to talk about pain, a conversation we've had in the past. Do you presume then that it is the instability in the joint that is the genesis of the pain, or is it the tears that people get? Where's that pain coming from?
The shoulder pain, multifactorial, and then it really is multifaceted, a complex area. You talk about instability. We can group into 2 major groups of instability: structurally related instability versus functionally related instability. Structurally means that some type of structure being out of whack. For instance, you have a torn ligament, torn tendon, structurally, mechanically, it is not sound, part of the bone is missing. So structurally related instability, by which oftentimes one may require surgery. But however, sometimes we could overcome those deficits without surgery with proper rehabilitation. Functionally related instability, meaning that there is asymmetric or uncoordination in terms of the balance of the shoulder as the arm is moving through space. So you see, look at my hand as the rotator cuff grabbing onto the ball of the shoulder. So as the ball is moving through space, the muscles have to respond instantaneously related to the direction of the arm is moving. So as the arm's moving in one direction, you think of, let's say, again, with a circle, as the arm's moving from, let's just say, from 12 o'clock to 3 o'clock. At that moment in time, from 9 to 12 o'clock, they have to be symmetrically relaxing at the same pace as from 12 to 3 o'clock is accelerating. So the deceleration has to match the acceleration. So when there is a mismatch, there's a micro slippage. This performed over and over again would cause micro damage, small injury, just like a leaking dike, eventually becomes like a large symptomatic problem in my shoulder, impingement, the so-called, the old concept of so-called impingement, or where we got from my textbooks, where we raise the arm, the shoulder moves up, and then it hits against the bone, the acromion. So we removed the bone. In the old days, we no longer do that. Remove the bone, so this way there's room for the tendon to move, but without really understanding that the reason why the tendon is impinging against the bone is because the bone is shifting. By keeping it depressed,
it's instable.
Strengthen it will not. That's right. That's right.
And what's the inflammation role there then?
Well, inflammation can be related to many reasons as well. There's intrinsic inflammation or extrinsic inflammation. Intrinsic inflammation, meaning that if a person unfortunately has some sort of inflammatory dysfunction, rheumatoid arthritis, or osteoarthritis, or just degeneration of one kind or another, is biologic. So that's we try to rehabilitate. Or extrinsic type of inflammation, meaning mechanical, being that over many times of misuse and abuse of the arm, where again, due to this micro subluxation with abnormal wear, rubbing of the tendon, creating the bursitis, and or repeated traction injury. For instance, as a person throws over and over again, there's always what they call an eccentric contraction as the arm is being, as you throw the ball, you literally trying to throw your shoulder out of the socket also. But your hand opens up, you release the ball. If you can envision that you don't release the ball, the entire arm can go out. Yeah. But the reason why the arm's not going out is because the rotator cuff grabs it. So every time the arm is thrown, grab it. 90 miles per hour, 60 miles per hour, over and over again, eventually it creates a little bit of tearing. That's where the biceps tendon, the areas tear, because they cannot respond fast enough to the accelerating pace of the arm movement. When we move the arm, there are 17 muscles move the arm. These are divided into large muscle and small muscle, but of those 17, only 4 are the small stabilizing rotator cuff muscles. The other 13, so it's roughly 80 to 20%. 80% of the movement when we move the arm are the accelerators. So they are always way more powerful than the stabilizers. So there's, in a way, many people have asked, can you ever over-exercise your rotator cuff? you can never over-exercise your rotator cuff. You always over-exercise your delts, your trapezius, your lats, all the other large major movers of the shoulder, never the stabilizers.
So let's talk then about shoulder sphere, and let's talk about it in both the non-operative and the post-operative. And because you're the surgeon, I'm going to ask you to start with post-operative. At what point are you introducing the shoulder sphere post-op if you've got, I guess the standard thing would be a rotator cuff tear?
Well, it really depends on the nature of surgery. Depends on the surgeon, depends on intraoperative findings, because repairing a tear, just like repairing the split in your wool sweater, they come in many sizes, shapes, and forms, and many ways of repair and reconstruction. Also, the major components, it depends on the surgeon, the treating individual really should understand what are the needs and the expectations of the individual, of the patient.
Mm-hmm.
What does the patient want to do? If the patient is a 21-year-old all-star pitcher, obviously different from a 81-year-old who who's being treated because of pain, but not because of, I want to go back to throw the baseball.
Right.
So it depends on the nature of repair. But everything in generality, after usually there is an appropriate period of rest after surgery to allow some tissue healing. And that period of rest ranges anywhere from 4 weeks to 6 weeks. We try not to immobilize the shoulder. As a RangeMaster, wonderful device, where with the pulley, I've personally tried out myself, your device. I even have one at home. Thank you for letting me have an extended borrow of this
I'm glad
device.
you mentioned that. Thank you for mentioning that. But go ahead.
No, I have many people use it. Physical. I mean, we know we don't even need to mention it because it's just understood. But it is a wonderful tool for assisted range of motion. So in the postoperative phase, gentle range of motion is number one. And that includes the pulley device with a physical therapist, a trained pair of hands for some what we call passive range of motion. And then at an appropriate time, when the surgeon feels that the individuals are healed appropriately, to allow some active range of motion. So then we can talk about active range of motion, but without against the gravity. In other words, you can do table slides forward and backwards. And then, of course, the next step would be against gravity, such as raising the arm. Raising the arm actually requires quite a bit of attention, pulling, tensile strength on the rotator cuff. Mm-hmm. The arm in general weighs about 10%, 1/10 of your body weight. The center of rotation for the arm is at a place that is about 10 times where the rotator cuff muscles insert. So by raising the arm against gravity halfway up, the rotator cuff has to exert about 10 times the weight of the arm, which because of the leverage effect, because of the arm actually wants to drop, but the rotator cuff has to pull. So this is the arm is dropping. So in order to prevent it from dropping, I have to pull it. Because of the center of gravity of the arm dropping from this position versus the location where the tendons are inserted, 10-to-1 ratio. So 10-to-1 and 1/10 your body weight. So one can just conceptualize it is equal to body weight tensile strength. If you weigh 150 pounds, to raise your arm up halfway up, your rotator cuff has to pull 150 pounds of pressure. Tremendous amount of pressure.
Yeah, well now, so keep going there because I want to know then at what point, because based on what you said previously, we don't really want to activate the larger accelerator muscles. In the next phase, I'm assuming that in the repair and the recovery, you want to focus in on those stabilizers without triggering the massive muscles. Am I right about that, or do you do it in a reverse form?
No, exactly. You're right. The first step is, of course, passive motion. When we talk about passive motion, it is very difficult for the person. For instance, with we just use your pulley, the upward pulley as an example. The person needs to consciously relax while the arm is being pulled up, because reflexively we always try to move the arm. And that's when you activate the major movers, and the stabilizers have to come into play. So you have to consciously try to relax and just let it passively move. So passive motion without triggering any of the muscles. But as the second stage with the shoulder sphere, I have a series of rehabilitation different phases of rehabilitation that fortunately many of the physical therapists have adopted in one way, shape, form or another as a guide in terms of rehabilitation. Because a wonderful way of isolating only the rotator cuff without triggering the major muscles is what I call the closed chain unweighted technique. For instance, I'm just going to move the video a little bit. I don't know if you can see it on the table here. The arm, the hand is rested comfortably on the table. And then all the person needs to do is to rotate it. I'm rotating the ball. My arm's not moving. You don't see my hand moving.
Right.
My arm's not moving. I'm just even just one finger pressure.
Look at that. And that's going to go all the way back up to the stabilizer.
What is making the ball rotate? Only the rotator cuff rotate. My large muscles, I'm not moving the arm. I'm not pulling the rubber band. I'm not moving a linear fashion. Everything is rotationally based.
So can the patient, let's say it's 6 weeks, can they do that
Phase
with
one.
a minimal
Tell the truth.
pain?
Yeah, tell the truth. I myself have, with my own patients, I have them start doing that in 2 weeks even sometimes. They just rotate the ball. And then that's phase one. Phase two is you inject some movement of the hand. See, I'm moving the hand while I'm rotating. So my large muscles are making my arm move while I'm also training the rotator cuff to respond simultaneously the movement of the arm. And then the next step will be with gravity. And then the highest level will be functionality, functional training, as if for those individuals go on the website, they can see baseball players use it, swimmers use it in a variety of different techniques.
What's the website?
www.shouldersphere.com. Shoulder sphere, one word. As RangeMaster.
SHOULDERSPHERE. Shouldersphere.com.
Correct.
Okay, we needed to get that in. And
Thank you.
Tell me about, I alluded to the fact that you have post-op and non-operative patients. With RangeMaster, we see about a 50-50 split. And then combined with that, we see our average patient is going to be between 60 and 85 years old. It's interesting to work with athletes, but most people's joints are just wearing out. So tell me about what you've seen so far with Shoulder Sphere. Are you seeing more non-operative or more post-operative patients use your product?
From my own tracing, I would say probably 75% are non-operative, 25% are post-operative with physiotherapy related. The non-operative ones are generally the population who want to avoid surgery. I have individuals, of course, we know from physical therapy studies, even though surgeons don't like that, we like to operate, but it is true that many individuals can contain their level of pain and maintain their reasonable expected level of performance. We're not talking about going back to being an Olympic swimmer, but just to performing a normal daily routine, we can manage a majority of the so-called tears and arthritis without surgery. And of course, based on the proper motivational factor. But some people, unfortunately, do require surgery. And I have a large number, I would say probably a good 50% are athletes who want to amplify their performance on the field, whether they're swimmers, they're fencers, they are archery, bow hunters, bow hunters, quite a bit of pull. And so they would use the shoulder sphere for that motion. I have, of course, naturally baseball pitchers, cricket players, volleyball players, very, very popular among beach volleyball players.
So active adults are really in your non-operative group. And how about, now I think you said that's about 75% non-operative, about 25% post-operative. Is that what you said?
That's about my guesstimate. That's just my guesstimate from in terms of the physiotherapy centers who use the device, and I would assume that they probably manage a lot of individuals after surgery, but I also see a lot of physiotherapists who manage individuals who have shoulder pain, because not everybody who go to physical therapy have had surgery. A lot of them, probably majority of them, have not had any surgery.
Correct. And then what about age? It sounds like you have a pretty good group of what I like to call the attractively active adults, people that are not kids anymore, but they like to stay active. Does that sound like your athletes?
Absolutely. I have age range from 14 to 98. I've had a 98-year-old use it. They just, I have individuals in nursing facilities, they just, they sit in a chair, they just rotate, spin the ball. It's kind of like a fun toy for them. They come in two flavors. The larger one is called the A7, and the smaller one is called F2. A, I stand for athletic, 7 ounces. F2, the fitness, 2 ounces. So generally, those fit individuals who can do 10 push-ups and can overhead press 12 pounds with a 12-pound dumbbell, they can use the large one. And however, the weaker individual, the ones who are recovering from surgery or injury, use a smaller one. 14 being the younger one because of the size of the splint. And then when I first made this, my first generation, the size of the splint is a little bit too long for individuals who are younger than 14, just because of the arm size of the arm. And as a person, so that's why the young, and also needs a little bit of a maturity to understand why they're using it. Although I do have a 12-year-old, fairly advanced tennis player, a 12-year-old who uses it, but it's still a little bit too big.
What about these people that are doing video games? Have you seen any?
I have a video game trigger thumb. Right. I've done many operations for trigger thumb. I've had many video game with thumb problem. I think the future of humanity may not need a shoulder, because we really rarely have to move the arm up and down. We just keep our arms on the side. We just go like this.
But those crazy days with posture, poor posture in front of a video terminal could give us future patients, if you know what I mean.
maybe the back and neck.
Yeah, exactly. Well, I want to go back to your older population, because that's I told you where our population resides. It would seem to me that the shoulder sphere offers a non-threatening form of rehabilitation therapy to an older patient who might be really guarding after they've had a history of pain. Have you had any success there?
Great success. Thanks for mentioning that. Exactly. It is non-threatening, because when one tries to pull a rubber band, just immediately you have to activate the large muscles, even though we can use a very light yellow band, but it's still just a form of arm exercise. We pull the band, we lift the dumbbell, or we do a little bit of a physical therapist with a perturbation exercise. But with the shoulder sphere, it's very, very easy. The physical therapist, for instance, just rest on the table, just rotate the ball. Looks like as if you're not doing anything, but you are doing quite a bit, because mathematically, one can calculate what is the rotator cuff power involved. Actually, that comes down to another facet of the discussion. One part of the athletic performance aspect is because the rotator cuff has to respond to the speed of the movement of the arm. So intuitively, we know that if you move the arm at 10 miles an hour slowly versus 30 miles an hour, require bigger muscle to move fast, but bigger muscle means a bigger deceleration.
Yes.
Bigger deceleration and faster rotator cuff contractility. So that's why I have, in addition, which we did not talk about, is this power tracking meter. That is the same device, 3-axis accelerometer that the iPhones use in terms of tracking your walking speed, your velocity, all the basic trackers, that even on Tesla cars, how fast you're going, everything based on this principle of XYZ directional accelerometer. So this is my generation 1. Eventually, of course, one can digitize the amount of power involved. It's just like in the Peloton bike, the power of output and so forth. So right now, depends on how fast you're rotating the ball, that dictates what light is. When the person is rotating the large one at a slow speed, it is green. When I rotate it fast, faster than 6 times per second, turns red. And what does that equate to? That equates to the ability of the rotator cuff to respond to a 60 mile per hour pitch, the movement of the hand, or a 90 mile per hour pitch, the movement of the hand. Because as the hand moves faster, my rotator cuff has to contract fast. And the speed of the contraction is power over the work over time. So that is where the power accelerometer comes in. So what an individual can gauge one's ability. So when a person says, well, can I go pitch 90 miles per hour? So so there are really 2 aspects. I've met hundreds of baseball players. One type, I can pitch 80, high 80s, 90, no problem. But I ask them to do the shoulder sphere. They're unable to spin it into the red zone in a smooth fashion. I can predict that these are the individuals who are at high risk for injury because you do not have the decelerator. Or a person says, I want to pitch at 90 miles per hour, but they're unable to spin it into red. So that's why they can only pitch slower. So the car can only go as fast as it should be able to stop. So when the person trains, it's like building the engine for the car. We weight lift, we power train to build a bigger and bigger engine, faster and faster car. Rotator cuff gives you better brakes.
I love your analogies, Wen, very clearly stated. Well, we've really gone over the amount of time we talked about, but I do want you to talk just a little bit. A lot of our medical professionals end up with an invention in their mind, but very few of them get it all the way to first a prototype and then a marketable product. What do you say? I'm sure other medical people come to you and say, how'd you do it? And what do I need to know? What kind of advice do you have for medical inventors?
One is have a little bit of luck and the support of your family, that they do not mind you tinkering around in the basement for hours and hours and forgetting to play with them and understanding family. That how did I initially, of course, one does not need much funding. You can just, I used to cut out baseballs, volleyballs and different balls of different types, my particular venture. And then of course I needed, eventually you get to the point where I was so consumed by trying to understand how does it work and what makes it work. One does need some funding. You can either get it from your friends or supporters and so forth to get funding. Well, I have to regrettably to say that since it took years, it was not immediate. As my daughters have grown older, and I realized that I no longer needed the life insurance coverage, so I cashed out my life insurance. Don't tell my wife that. But so I figured that they no longer need my life insurance to survive. They can be on their own. So I have very little insurance policy now. No. So I use that as my funding. And then things that start to equalize out. So I'm happy. I'm happy with where I am right now.
Yeah, and so you'd say to the other inventors, don't discourage yourself, but be resourceful in how you go about it. Now, I've seen you a lot of trade shows, and has that been the most? Because at a trade show, you have to pay for the booth, and then you got to show it to other therapists or doctors, and you have to be able to put up with some criticism or some input. Would you recommend that pathway again, or are there other pathways that you might say to other inventors?
I think it's kind of obligatory. I myself, I really looked at it as my opportunity to travel because I love traveling. Besides the trade shows that we've met each other, I personally, no trade shows, but I ventured to over 16 countries. I wanted to meet people who don't know me, who are not involved with any facet of being treated. I want to see how they react. I was in Cyprus. I had a chance to play the bongo drums with a swing team in Cyprus. So I hung out in Cyprus. Cyprus, of all places. I went to the local gyms. I just took it over there. I asked people to try it. I was in Iceland. I went to the largest CrossFit facility in the world, probably at that time, Annie Thorstadter in Reykjavik, Iceland. Because I love traveling. I met the world's strongest men. I met all the big heavy lifters. I was in Italy. I was in England, in France. I was all over the place, just to convince myself that people are not contaminated by seeing me as a physician, by seeing me at a trade show that I'm sort of like the expert and so forth. I want to see people in the real light. And actually, in the very beginning, a good friend of mine, we actually went undercover, went to Dick's Sporting Goods and presented my early prototype to individuals. You may even see some of that on my website, the videos, where we say that we're salespeople for this company, just want to test out this product. How do you like it? I want to see their reaction. So perseverance is a key, and be steadfast with your goal. And as long as one is motivated and have a goal in mind, but of course you got to enjoy your journey. As my brother has always said to me, the journey is the destination. So my end goal is really not to make a product that people can buy. My journey is talking to you, meeting Rob Allen, and as San Antonio a river walk with your cowboy hat. That is my enjoyment. That is what I enjoy. Well, and I enjoy. So, what do you do? Oh, yes. So, but in a way, it's weaved into my area of expertise, my training. I enjoy travel, enjoy food, because when you travel, you eat everything.
Yes, you do.
I was in Thailand eating cow blood. You don't want that. But I try. So that's where I gained my wealth of my confidence that I know it works. No question in my mind.
Yeah. Win Chang, orthopedic surgeon and inventor, thank you so much for spending time with us. And we'll get you out. We'll show you out to 20,000 subscribers of our newsletter. We'll see how many open it up. And fascinating. Always fun to talk. Thank you very much.
Thank you so much, Rob. And please, next visit, I'll be at the farmer's market.
Hey, that's one of my favorite places too. All right.
That's
Bye-bye
right.
now.
Take care.
Goodbye.
Have a good day.